Curriculum development. Lecture objectives. The concept of curriculum. Authentic curriculum from university to the real world. Feature of authentic learning. The planned, the delivered, and the learned curriculum. Questions to ask when planning a curriculum. Sequencing curriculum content and the spiral curriculums. What's the importance of sequencing? Guidelines for sequencing. Relationship between basic and clinical sciences. Spiral curriculum. Features of spiral curriculum. Transition or bridging courses. The curriculum is more than just a syllabus or timetable. It embraces all of the learning opportunities, both formal and informal. The concept of a curriculum. The curriculum was equated in the past with syllabus and the timetable for the education program. A curriculum document included a statement about content, the subjects covered, and the course that students should attend. The curriculum has been widened to include learning outcomes, teaching method, educational strategies. Also, it includes context for the learning environment, assessment procedure. The curriculum is seen as an expression of intentions, mechanisms, and context of the education program that requires input from all of the stakeholders, including teachers, students, administrators, employers, and the government. Also, the wider public included. There is authentic curriculum from university to the real world. In medical education, there is a move to an authentic curriculum in which the learner will have the ability to perform in the workplace as an outcome of the education program. Medical schools criticized and praised to ensure that the doctors trained are able to meet the healthcare needs of the population that they serve. In line with the concept of an authentic curriculum is a move to, first, an outcome-based approach with an emphasis on professionalism, empathy, and self-regulation. Second, education strategies, integration, interprofessional education, problem-based and task-based learning. Third, socially accountable medical schools. In traditional curriculum, the emphasis is on acquiring knowledge and skill to pass an examination, while in an authentic curriculum, students acquire the foundational skills, knowledge, understanding, and attitude that they will need to practice as a doctor. This involves connectedness, where the teaching has value and meaning in the real world. Relevance is the key to effective learning, where students' engagement with their studies is directly related to their perception of the relevance of the content. relevance can be seen as relating to the intrinsic value of what is taught. For example, knowledge of hormone synthesis pathway in the thyroid gland will help the student to understand the actions of antithyroid drugs in the treatments of patients with thyrotoxicosis. The other aspect of relevance is the instrumental value. This is a demonstration of relevance where the content is shown to be immediately useful in practice. In this figure, relevance can be seen as relating to the intrinsic value of what is taught. For example, knowledge of hormone synthesis pathway in the thyroid gland will help the student to understand the actions of antithyroid drugs in the treatment of a patient with thyrotoxicosis. The other aspect of relevance is the instrumental value. This is a demonstration of the relevance where the content is shown to be immediately useful in practice. Four quadrants are shown in the figure. The bottom left quadrant can be identified as the ivory tower, where there is no intrinsic or instrumental value of what is being taught. This sadly remains the home of much of what is covered in the medical curriculum. In the bottom right quadrant, students have the opportunity to apply what they have learned, but it's not relevant to medical practice. This is typical of many practical classes. For this reason, many practical classes in medical education have now been replaced with more meaningful learning experiences. In the top left quadrant, we have superficial authenticity. Here, the teaching is dressed up to appear authentic by references to real-world elements. It's not sufficient simply to tell the student that what they are learning has applications in medicine. In the top right quadrant, we have the authentic curriculum in the real world. Ask students to engage with content as though they were practitioners in that field. Such authentic learning is vital if students are to acquire the competencies necessary to practice as a doctor. Years of authentic learning. The activity involves real-world problems. Students are emotional stakeholders in the problem and learning exercise higher levels of thinking as they learn. Authentic occurs through discourse among a community of learners. Also, learning is student-centered and students are empowered to direct their own learning. The planned, the delivered, and the learned curriculum. Planned curriculum documented and agreed by the curriculum planners and teachers, while delivered actual curriculum, the reality of student or trainees' experiences and is what is delivered or happens in practice the curriculum in action. The learned curriculum represents the student's knowledge, skills, and attitudes that result from their learning experience. Questions to ask when planning a curriculum. First, what is the medical school or training program's vision or mission? What are the expected learning outcomes? What contents should be included? How should the content be organized? What educational strategies should be adopted? Teaching method should be used? How should the assessment to be carried out? How should details of the curriculum be communicated? What educational environment or climate should be fostered? How should the process be managed? What is the medical school or training program's vision or mission? Kind of doctor in the medical school aims to produce? Is it the future teacher or academic research worker or doctor who is able to work with local community? In Australia, Canada, Scotland, and other countries, there is a need for doctors to work in rural areas. Medical schools need to recognize that there is now a greater mobility in the medical workforce, and doctors need to have the necessary skills to function effectively in whatever part of the world they are working. What expected learning outcomes? Key to a curriculum are the learning outcomes that can be described as they relate to technical competencies and clinical skills, approaches to practice impressing an understanding of the basic science, appropriate attitude, and decision-making strategies. What contents should be included? Decisions needs to be taken regarding what to include in the curriculum and what to omit. Decisions about what to include at each stage of training must be taken in light of the agreed learning outcomes. There is a core content that have to be mastered by all students. Doctors can now readily access information through the internet and other sources when they require it. How should the content be organized? The sequence of the traditional approach in clinical education. First, introduce the student to basic medical sciences and normal functions, structure, and behavior of the human body. Secondly, focus on abnormal function and the development of clinical skills. Third, later, students develop their clinical competence on the job as they manage patients. This sequence has major disadvantages. One of these is the relevance of the contents is not obvious. There are alternative ways of sequencing the contents that lead to more effective and efficient learning as students progress through their training. Educational strategies should be adapted. The educational strategy adapted may be seen as the key element in the curriculum, with the curriculum even labeled in terms of the dominant educational strategies. For example, a problem-based curriculum or a community-based school. The SPICE's model of educational strategies is student-centered, teacher-centered, P, presentation-based, information-oriented, I, integrated or interprofessional, discipline-based, C, community-based, hospital-based, E, effective-driven, uniform, S, systematic, opportunistic. The most appropriate point on each continuum is likely to be somewhere between the two polar points. SPICE's model can be used also for curriculum evaluation. What teaching method should be used? The teacher's toolkits. The teacher should have a comprehensive, up-to-date range of tools for teaching and learning. Students or trainees have the right to expect that teacher will incorporate in his teaching the most appropriate for the stated learning. How should the assessment to be carried out? Assessment is a key element in a curriculum that influences students' behavior. A performance-based assessment, like objective structure clinical examination, like the OSCE assessment portfolios. B, work-based assessment, particularly in postgraduate education. How should details of the curriculum be communicated? Students and trainees require a system with understanding what is expected of them, the learning opportunities available, how they can make best use of the learning opportunities, their progress through the curriculum. There's a need for a curriculum document that includes a clear statement and explanation of the expected learning outcomes, a series of blueprints relating to learning outcomes to the available learning opportunities, the phases of the curriculum, and the assessment. A curriculum map that shows the relationships between different elements in the curriculum. The educational environment or climate should be fostered. Education environment represents the overall atmosphere students experience wherever learning takes place. The extent to which students feel they are studying in a supportive or threatening environment, whether the environment encourages teamwork and collaboration, appropriate professional behavior, and creativity. A number of instruments are available that allow the educational environment to be measured. How should the process be managed? Curriculum development and management is an important and demanding activity that requires careful planning and allocation of time and resources. Most medical schools set up committees charged with responsibility for the curriculum. A curriculum planning committee should represent all stakeholders, both hospital and community-based interests, junior and senior staff and students. members of staff should be allocated responsibility for implementing the different aspects of the program, including coordination of each phase in the curriculum, organization and delivery of each course, management of electives and options, student assessment, support for students, computer and information technology, and last, a clinical skills center and the use of simulators and simulated patients. Educational programs that are most successful have strong leadership from deans or clinical directors with support given by them for changes and innovations in the curriculum. The sequencing curriculum content, how we sequence curriculum contents, and the spiral curriculum. Sequencing curriculum content can prove complex. Some approaches to help the learners achieve the expected learning outcome may be more effective than others. The importance of sequencing. Sequencing of courses in the curriculum involves the arrangement of courses in a specific order. For example, the earlier introduction of clinical experiences in the curriculum provides students with a context for learning the basic sciences. Secondly, establishing connectivity and interdependence of the courses. Students should be assisted in identifying connections between courses in terms of what they are currently learning, what they have previously learned, and what they have still to learn. This should be made in a curriculum map. Curriculum sequencing involves managing the students' learning route in a way makes it easier for them to achieve the learning outcomes. This may involve moving from the simple to the complex, general information or principle to a more detailed consideration, basic principles to application and practice. Now, guidelines for sequencing. Prerequisites, the knowledge or skills that the student needs before entering the course. The course content, what the students are required to study to master the expected learning outcome. And third, application of competencies gained. Students continue learning following the course. Now, what's the relationship between basic and clinical sciences? An important issue in sequencing relates to the relationship between the basic science and the clinical subject. In the traditional undergraduate curriculum, it was assumed that students should first acquire an understanding of the structure and function of the body before they considered pathology and clinical medicine. In recent years, this sequence of courses in the curriculum has been questioned. Early clinical experience has been shown to have major advantages. Now, what is spiral curriculum? Relevant to the concept of sequencing is the idea of a spiral curriculum where there is an iterative revisiting of topics, subjects, or themes. More effective learning can result when the learning content is presented in smaller chunks, and these are revisited later, rather than when the content is presented in one larger chunk. Learning over time, spaced learning occurs. For example, when the cardiovascular system is considered in phase 1 of the curriculum and revisited again in phase 2 and 3, this helps to ensure that the information and understanding gained is not degraded. Of spiral curriculums. Topics are revisited. There are increasing level of difficulty. Each return visit has added learning outcomes and presents fresh learning opportunities to help the student work toward the final learning outcomes. New learning is related to previous learning. New information or skills introduced are related back and linked directly to learning in previous phases of the spiral. Competence of students increases with each visit until the final learning outcomes are achieved. Transition or bridging courses. As students progress through the curriculum, it's important that the transition between the different phases or courses are as seamless as possible. To facilitate this, a bridging program may be necessary. Transition or bridging courses may take into account students' individual achievements and competencies, also ensure that they have the prerequisites necessary for the next step in their training program. Thank you very much.